I'm Pooja Yadav. Welcome to this exclusive conversation presented by ETHealthWorld. Today with us, we have Dr. Niti Raizada, Principal Director, Medical Oncology and Hematology, Fortis Group of Hospitals, Bangalore. Thank you for joining with us, Dr. Niti. So let's start with a common perception that bladder cancer is quite rare. So Dr. Niti, is it actually uncommon or are we just not paying enough attention to it?
Very rightly said, Pooja. This is amongst the top 10 cancers globally. And in India itself, almost 12,000 cases are diagnosed each year. And at one point in time, the cumulative 5-year incidence is 60,000 cases. So 60,000 cases are there at this point. And what we have in our country is not actual figures because they are underreported. Quite a few don't come on time. So it's actually a very prevalent cancer. We don't talk about it as much. And amongst them, because we don't have as much as this cancer being discussed, so often, especially in our country, we see almost 30% coming late and advanced stage, which in the West is only about 10 to 15%. So it's a common cancer and presentation is very subtle. And once we know it, the number increases, the diagnosis chance increases.
And another widely held belief is that bladder cancer only affects older individuals. So should younger people also be concerned?
Urinary bladder cancer or any cancer happens in aging population. So yes, cancer is a disease of aging population, but remember it happens in the entire spectrum. And the causes associated with this cancer is lifestyle related. Addiction, especially smoking. Smoking increases the risk by 4 times. There are certain infections like schistosoma infection, especially in Africa and Middle East. They increases significantly the risk. All these happen in younger individuals. It also happens because of industrial pollution. It happens because of occupation, like certain type of chemicals, dye, rubber industry. And all these also can sometimes happen in younger individuals. So it can happen across the spectrum, also seen commonly in younger individuals, especially over 30 years of age.
And there's also a common assumption that if something is not painful, then it is not serious. So how risky is that thinking when it comes to bladder cancer?
The pain is an easy symptom which brings you to a doctor. If you have persistent headache, you'll go to a doctor. If you have persistent knee pain, leg pain, you'll go to a doctor. But painless symptom generally is avoided anywhere. And the most common symptom of urinary bladder cancer is painless blood in urine, painless hematuria. Even a single episode should not be ignored and we should report it to a doctor. Normally what a doctor will do is generally ask for a urine test. So they will ask for urine to look for any blood is there. And if that blood is there any abnormal cell with it? It's known as urine cytology. Along with that, possibly an ultrasound will be done, which tells us whether there's a risk of cancer happening in the bladder.
And many people also tend to believe that if a symptom disappears on its own, it is nothing to worry about. But if someone notices blood in urine once it goes away, should they be concerned about it?
If a young woman and blood in urine is related to menstrual cycle, it's different. But any unassociated blood in urine should be reported and should be evaluated. Also remember that if there are symptoms along with it, like low back pain, like dragging sensation in the pelvis, or sometimes associated motion difficulty, difficulty in passing urine, not just blood, but difficulty in passing urine, all these also are symptoms which should be evaluated.
And there's also this notion that cancer just happens randomly. So is that really the case in bladder cancer?
I'm not sure what is the question, but randomly, yes. I mean, most of the time, there are a lot of factors which are associated with bladder cancer. So as I said, smoking is one important factor. Certain type of infections like schistosoma, certain type of occupations like chemicals, dyes from the industry, arsenic in soil. These are definitely associated. Chronic inflammation, like if you have a urinary catheter, generally for older people for a very long time, or if there is a chronic urinary tract infection, which happens recurrently. So recurrent urinary tract infection, stones, which could be large stones in the bladder, these can cause. So there's an event which is causing. That's not random. There is a chronic inflammation which is set in, which eventually leads to cancer. But often there are cases where you don't have a direct association. So there you can say, well, it was idiopathic. So cause was not a certain. So you cannot all the time assess that this could be a potential case for bladder cancer. But there are certain cases where it is not that random.
And another misconception that already you spoke about is smoking, that mainly people resonated with, it affects just lungs. So does it have, like, what kind of impact does it have on bladder?
The chemicals which are related to tobacco, and especially smoked tobacco, could affect various organs, starting from head and neck, like mouth cancer, esophagus cancer, lung cancer, of course. Then even cancers like stomach, pancreas, bladder, which we are referring right now, significantly associated. So it just does not affect the lung, but various organs. Quite a few cancers. In India, the data is almost 3,500 to 4,000 deaths per day are only related to tobacco-related cancers. So imagine the magnitude. And bladder cancer, this is one of the most common associations.
And finally, if we had to cut through all these misconceptions, so what is one message you want to, want viewers to remember?
So one important thing is, this is a very important cancer. Only one episode of painless blood in urine, painless hematuria, you should get yourself evaluated. The only evaluation required is urine cytology. And sometimes imaging. Your doctor may ask for a CT scan. So CT of the bladder, ureter and kidney. It's known as CT KUB. Sometimes an MRI of pelvis is required. Why we are doing it? To diagnose the problem early. And once anything is diagnosed early, it is treatable and curable. Often an early bladder cancer just requires only local treatment, which is curable. So please make sure that you go to a doctor at the earliest symptom and diagnose your condition on time.
So a very common fear is that bladder cancer is always life-threatening. So how accurate is that?
Well, this is a misconception with all cancers. The answer is absolutely no. It's a continuum of things. As I said, early bladder cancer, it's known as non-muscle invasive bladder cancer, and then muscle invasive bladder cancer, they are absolutely curable. Treated correctly, and once diagnosed, treated accurately is what is required. So timely diagnosis and right treatment, these two things lead to very good results. Even in an advanced stage bladder cancer, there's treatment.
Okay. Thank you so much, Dr. Niti. It was wonderful insights.
Thanks, Pooja. Thanks for inviting me.